Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. A couple weeks ago, I was sent a video, and it was about a gentleman who had come to New York from Oregon's incident management team during 9/11. He and his team of about 40 people had stayed in New York for about a month. They had gone back to Oregon and over the years started to develop some health issues, just like the rest of us. And they too had the ability, because they were national responders, to join the World Trade Center Medical Monitoring and Treatment Program, the national program. The national program. And I say that kind of facetiously because the World Trade Center program has been failing its responders and its survivors. And part of the problem is this nationwide program, which used to be run by LHI, which is now run by Sedgwick MCA, which is owned by the Carlyle Group, which is a for-profit private equity firm, is delaying and denying care, and there really is no real network. As you are going to hear from Mr. Lohrey and his wife, Teresa, I want to first play for you the video which this was brought to my attention, which was an interview he did with a news outlet in Oregon. And then I want to show you our interview with them. We're calling on our New York State elected representatives, as well as NIOSH CDC, Dr. John Howard, Senator Kirsten Gillibrand, Senator Schumer, Congressman Jerry Nadler, to make sure that they call a hearing into the way that this MCA Sedgwick is running the World Trade Center Health Program. They have signed, I guess, a 4-year or so contract. And in the last 2 years, our members, our beneficiaries of this program, have been complaining that their doctors are no longer in this network. They can't get the care that they need, and they're having to pay for it out of pocket. So a couple of weeks ago, I wrote a letter to John Howard, Dr. John Howard, and I was disgusted after seeing this video. I sent him an email with a link to this video stating that what this man had to go through was criminal. Dr. Howard wrote me back and basically took offense with my choice of words. It was my vocabulary that upset him. He took umbrage to the fact that I said that this is criminal. What is criminal is that a responder would have to fight for their life to continue to get health care that was promised to us 20-something years ago. Now, what he should be upset about is that we are not getting the care that we need, that we can't access doctors and hospitals, that we as responders are paying out of our pocket for care that was promised to us. And that with every last breath, and you will see that Mr. Lohrey has trouble breathing, and that he would have to fight for his own health care amidst fighting for his life. So for this, we call on our New York State elected, as well as Dr. John Howard. This contract must be canceled. A new vendor must be put in place. We need to stop privatizing our healthcare, and we need to make sure that there's transparency, complete transparency. Whenever a vendor says that they have a nationwide provider network, that there are providers all over the country, in every state, of every county, otherwise, it's not a nationwide network. And the mere fact that MCA Sedgwick took their provider tool off their website means they're hiding the lack of a network. So we also call upon all of the state's health departments, since this is the nationwide program. Every state Department of Financial Services or insurance department should be investigating MCA Sedgwick and the Carlyle Group for falsely representing that they have a quasi-nationwide network. So now I'd like to show you this video of Mr. Lohrey.
Well, I've been in a command position since 1989 in the Forest Service.
Plaques and pictures displayed inside Mike Lohrey's Fairview home mark a storied career as an incident commander.
National teams were immediately dispatched for major disasters, presidentially declared disasters.
His missions took him far and wide, responding to hurricanes in the east to battling wildfires in the west. One of the biggest missions took him and a team of 40 to Manhattan, New York.
This was a terrorist attack, obviously.
in the wake of 9/11.
10 days later, we were there.
For 30 days, they worked alongside New York's finest, setting up warehouses and stocking up supplies.
And it was a privilege because just helping out the people, I mean, especially the firefighters that are our brethren, you know, helping all those folks out best we could.
Mike recalls Ground Zero, or the pile that continued to burn for days and days.
And if you went down there at night, you could see particles and dust all over the place.
The images of that time stayed etched in his mind in the years that followed, as health impacts began to show.
I wasn't diagnosed with it until fairly later, and then it went boom.
For Mike, it was fibrosis, lung disease.
Finding out more about the health issues, and 25% of the people that went with me to the World Trade Center are either have passed or have a disease similar to mine or have cancer or etc.
On oxygen 24/7, and with his condition quickly deteriorating, Mike needs a double lung transplant, one he hopes to get after undergoing a series of tests at St. Joseph's Hospital in Phoenix. But just getting to this point, getting pre-authorization for those tests, was infuriating and frustrating.
They move like molasses.
And slow. It took months for the right people to sign off.
Well, if you die if your time's limited, not my problem. They just don't care.
Those feelings directed at MCA Sedgwick, the contractor in charge of administering nationwide provider network services for the World Trade Center Health Program, focusing on the tens of thousands living outside New York.
The program is not health insurance. The program only provides limited benefits for certain conditions that the program will cover.
Benjamin Shavat, the executive director of 9/11 Health Watch, a nonprofit advocacy watchdog group, says in the short time that MCA Sedgwick's had the government contract, since late summer 2022, members have encountered a series of problems.
They couldn't answer the phone. They had wait times of hours. There were real problems with their network. Again, in the title, it's called the National Provider Network. And their network was not as good as the previous network. Lots of different issues in terms of service delivery.
Mike and his wife, Teresa, ran their complaints to the top.
And we had to go through their bosses. We had to go to CDC, hold their feet to the fire to get something done.
If Mike did not have me to advocate for him, he probably would not be getting even the evaluation for the lung transplant. He would not be able to fight the battles with Sedgwick.
And although their issues were eventually resolved, they worry for others who rely on this contractor for life-saving benefits.
Like pushing a rope up a hill.
In a statement, the CDC told KGW they are aware that some members in the nationwide provider network have experienced issues in accessing care in the WTC Health Program. The WTC Health Program continues to actively work with managed care advisors to optimize the service they are providing, resolve any member concerns, and ensure ongoing performance improvements. We never heard back directly from MCA Sedgwick. For Mike, a working set of lungs can't come soon enough. But when asked if he has regrets, if he wishes he hadn't gone, his reply,
No. Like I said, I'd do it again, even knowing the results.
In terms of getting assistance, the CDC encourages any member who is experiencing challenges getting care to contact the World Trade Center Health Program. That email is wtc@cdc.gov. There's also a number. We'll have that up on kgw.com. And the 9/11 Health Watch group has a portal where you can contact advocates directly if you're having problems accessing this care. Blair?
Alma, thank you.
And now to segue to our interview with Mike and his wife.
We were originally mobilized with command and general staff only for an assignment that was turned out to be illegal. In other words, they were altering money. They were using money and using it illegally from the government. So thought we were going to turn right around and go home, but it turned out that the National Guard had been given an assignment that they were failing at big time. And they were supposed to be putting together a warehouse that was partially, that had never been completed on the East River, and also to provide logistics caches around ground zero for 24/7 staffing for tools and things that they might need on the pile. So we were given that assignment plus the Fresh Kills landfill site for a cache up there as well. So that was our assignment, and worked with directly, that was given to us by Mayor's Office of Emergency Management through FEMA. And we started with just an aside, National Guard didn't even show up to the in-briefing. And then they showed up, the colonel showed up on site, tried to tell me how things were going to go, and I had to tell him, no, that's not how things are going to go. This is how it's going to happen. And I never saw him again. But two of those National Guard people ended up getting arrested for stealing stuff. Yeah, from the donations and stuff that went in. And that was pretty much the assignment, kept us busy the whole time, looking out into the future for what they were anticipating their needs on the pile, being there 24/7, worked a lot of times. I was downtown every day at Duane Street ICP, working with FDNY. And at one point, those guys were throwing up their arms because they couldn't put out the fire. And my deputy volunteered us to put out the fire. And I'm like, what are you doing, Bob? But they looked at us and I thought, oh no, they're going to say yes. But they didn't, thankfully.
Yeah,
So,
those
anyway,
fires burned through the end of December.
yeah, I know. He had some grandiose idea that wouldn't have worked, but anyway.
So you went home, when did you start to feel some health issues?
Oh, I didn't feel any real health issues until
After we met.
yeah. What was that?
We met in 2019, got married in 2020, and he had a cough on our honeymoon in Hawaii, and that was the start of it. Actually, it was later that year that he had a follow-up with the monitoring program, and they said, oh, we see fibrosis now in your lungs.
And you'd been checked every year? Were you going like on an annual
yes.
checkup and then all of a sudden something popped up?
Yep. That's exactly how it happened.
Once that was established, it just started escalating every month. After that, till he landed in the hospital, which was Thanksgiving, the Monday following Thanksgiving of 2022, he was in for a week or just about a week, and lost 30 pounds, came out needing a whole lot of oxygen, finally 24/7 oxygen, and not being able to walk around much because there's not enough oxygen when he gets up to walk.
Yeah, I fell off a cliff is what it amounted to up until that point. And I came back from week of hunting upland birds in Montana where you cover a lot of miles. Well, I wasn't covering as many miles as I usually did. So I knew that it wasn't right, but I didn't think I'd come home and then just collapse, basically, which is what happened.
Plus, we always walked the dog, and he was having to stop walking the dog because he thought he was going to faint.
Lightheaded,
This was so each month in the summer of 2022, it was getting worse, and we didn't know it. Kind of, right? You don't know what's going on till it becomes so hard to breathe that he was hospitalized. It was an emergency.
Wow. And so now you said you're in Oregon when this was happening.
Oh, yeah.
And so you went to your doctor, you went to the World Trade Center program. Was it them who diagnosed you, or your GP, or how did that happen?
The monitoring picked up a spot on my lungs. And then wanted to know where I wanted all sent to. Well, because they were out of network, all that stuff out here is out of network. And so I didn't know where the heck to send it to. I didn't even have a doctor. I was that healthy. I just nothing happened to me. So anyway, I did go in and have it checked. Somebody took another x-ray and they said, I don't know what it is, but I don't think it's what they said. So I just thought, well, not too much to worry about. And then when I had the CAT scan after I was referred to a pulmonologist, and they said, well, you've got this thing going on, and it's in both lungs. There's no cure for it, but there are some drugs that may slow it down. And they tried some various things, et cetera, which
Didn't work.
Well, they didn't work, plus they're oversold. They don't work as advertised either, and they're toxic. So it was the second one particularly was actually ended up being a very big setback for Mike's health.
Oh my gosh.
Yeah, it's just like having when they tell you the treatment's worse than the cure, sometimes, I mean, worse than the disease. I can understand how that's true after that one drug that I took. So
Yeah, I had a similar experience with a similar situation. Not respiratory, but orthopedic, and how much drugs they put me on was supposed to make my life better, but the drugs made my life worse. So after you finally get this diagnosis and you bring all of this back to the World Trade Center program to certify your illness, what happened there?
they certified it, but they had to put the doctor in network, the hospital in network where I ended up at, etc. And that's where part of the problem began with Sedgwick, because we were told when I was in the hospital that this was a secondary insurance by Sedgwick, that everything should go to Blue Cross Blue Shield first, which is FetBlue. We had Federal Blue Cross.
Which was your primary health insurance. Yep.
Yeah. And then.
Well, actually, hold on a second. You're a first responder, technically, aren't you?
Yes.
We got bad advice.
Yes.
For over 6
but
months.
That's the advice we got from Sedgwick initially.
Oh
No,
my
no,
gosh.
they goes here first, and we'll make sure you don't pay anything, but they pay, then we pay.
So what happened was, since I didn't have any background with LHI or anybody, once Mike had been hospitalized and we start getting bills, then I'm trying to forward what's left over from Blue Cross Blue Shield on to Sedgwick. And for 6 months, nobody at Sedgwick looks him up to see if he's a first responder and clue me in that we should have been billing Sedgwick first.
Correctly.
And it says that right on the card, it tells you right on the card.
But
You know,
we
but-
don't know these things because now,
You got family now.
we're in a trauma situation, right? And
Yes.
so we're learning everything the hard way. And so I would call Sedgwick and I'd go, hey, we've got these bills. Why aren't they being paid? We'll get to that. Don't you worry.
Oh yeah, they have me in collections right now.
And then
Oh,
we
they
went
put
into
us in the
collection.
collection.
Yeah, we went into collection for
For
$40
$40
copays. It was $120 owed to Legacy. And I kept calling Legacy and I'd call Sedgwick and I'd call Legacy and I'd call Sedgwick and they sent us to collection. Well, now I have just a little bit of an upset. And because we have perfect credit.
So do I, except this.
I was in the mortgage business, and so I know what a collection means, right? And how hard it is to
Yes.
get it back off.
Yes.
Well, so my phone calls got a little bit more strident, you might say. Anyway,
You let your inner New Yorker come out.
Oh, golly, yeah, it happens. So that's when finally somebody at Sedgwick said, those should have been sent to us first. I'm like, what? So it was like that. And so what ended up happening was,
All the bills from the hospital that had been accrued and federal Blue Cross Blue Shield had been paying, Sedgwick had to redo and pay the hospital, and the hospital had to give money back to.
They had to reimburse Blue Cross Blue Shield Federal. So the last bill to get paid was actually the big hospital bill, and that came after we tried to get this transplant initiated with Sedgwick, and after we got this gentleman from the CDC involved and intervening on our behalf. Well, then, before we left town, that last big bill, the hospital bill, was paid by Sedgwick. And so our needs got met, I guess. But when I will say this, when we called St. Joseph's, they took our call. They said, yeah, sounds like, you're the kind of patient we entertain. And so when they went to get the pre-authorizations for over 50 tests, that includes a lot of blood tests and such, but genetic blood tests, cancer tests, when you need a lung transplant, yes, a lot of people don't realize this, even people at Sedgwick, they won't give you a transplant if you have cancer, if they find cancer. So the St. Joseph's sent to Sedgwick the way they normally would do things, paperwork requesting that, okay, we want all these tests approved, and Sedgwick doesn't know what they're doing. So they then sent a letter, which I have a copy of, that says, well, we'll approve these, but these other ones, maybe not. And that's it. And St. Joseph's went, what?
What the hell?
They said, yeah, that exactly. And so it turns out that when you go to a big insurance company, Regions, Blue Cross Blue Shield, and you need a transplant of any kind, they have a whole department that handles that kind of paperwork.
Yes.
They kind of know what to do.
Yes.
Because they've done it before. So
Yes.
when Sedgwick gets it, I won't say the woman's name, but she was a manager. And when St. Joseph's called this woman, the manager, to say, hey, we need more information than maybe. And we also need to know how much, you're going to pay for these, because that's the way that works. The manager said to the woman at St. Joseph's, who only handles financing and stuff, said, we don't think Mike needs cancer tests, and we'll tell him he doesn't need to get that from you. And the woman went, what the heck?
Come on, you can say it, girl. What the hell?
So that's when I kind of blew my stack just a little bit. And that's when I called the World Trade Center direct, and on their 800 number, I got a hold of the receptionist who answers the phone at the World Trade Center. I explained our problem with Sedgwick. She goes, huh, that doesn't sound right. Hang on for a minute. Goes and talks to a manager, comes right back and says, yeah, that is not good. And here's what you need
No.
to do. And she sent me to a web page that ended up being a complaint form, which I then filled out that night. And the very next morning at 8 p.m. Portland time, we got a call from the CDC, from a fellow at the CDC, a nurse. And that's when things started happening, because now he's intervening. And so, long story short, it took 4 full months for Sedgwick to do all the paperwork required for this, just for the evaluation. And we're not talking about any surgery that costs $1 million. This was just the evaluation. They also had to add St. Joseph's to their network, which actually added more time when they figured that out too. But so I don't know if this is good for you to put on the YouTube or not, but one of the odder things that Sedgwick did was when St. Joseph said, hey, we need to know how much you're going to pay for each one of these 50 some tests. Well, Sedgwick apparently thought, well, we don't know what to do. So here, what they did is they sent to St. Joseph's a spreadsheet. And the spreadsheet is all the insurance codes for everything from one aspirin to a surgery. Okay. I mean, we're talking, there were 21, they sent me a copy of it too. There's 21,000 lines of information there. You go through, and I guess they break it up into groups of information.
These are
But
CPT code, or
yeah,
these are their ICD codes or CPT codes?
I guess so. Yeah. So I looked at it. I'm like, oh, they're going to tell St. Joseph's all their secrets, basically, and let St. Joseph's figure it out for themselves how much money they will receive for these various evaluation tests. And it appears to me that that might go like that now that Mike is conditionally approved for the surgery. They will need now all of everything that would happen during a surgery, plus everything that will happen in his recovery in the hospital and outpatient, etc. They will need all of that at this point. And I guess they're just going to let St. Joseph's figure it out for themselves. I don't know. It was insane. People that I know who are in the medical business went, what? What? Nobody does that. Nobody.
Oh my God. And so this whole process to get to approval or conditional approval took how long? So
Well,
that he could
now
start
it's been,
this process?
Well,
We
we started
started-
that in November because we were thinking we were gonna get down there in December.
so here we are, it's the beginning of April. Now it's been 5 full months. But now we have all of those 50 some tests done. And they actually need a couple of more that I won't go into the details, but the approval's a little conditional, and we hope within another week or 2 weeks at the most, those conditions will be removed, and then Mike will get listed. At the same time, they have to get this approval from Sedgwick, because he won't be listed unless St. Joseph knows they will get paid. So,
And if you have any issue with that, I need to know.
well,
Because you'll
we've
have me
already,
and Richie being able to yell so you could save your breath.
well, I do know that I sent an email yesterday on Sunday to our contact at the CDC, and I said, hey, this is next, and anything you can do. Well, he already has sent or called Sedgwick, and Sedgwick is on notice to look for this new request from St. Joseph's. So
Wow.
that's a good sign.
That's not how it should work. Should
No,
be able just to okay, contact them, you should get a response back like any other insurance company and
Yeah.
move
Like 1 to
on.
3 days. Yeah.
Yeah,
Yeah. We're fighting that prior authorization issue in New York because our mayor is trying to force us into Medicare Advantage off of Medicare. And so knowing that many of my retirees are 9/11 responders with illness, until our health care, our diagnoses are certified by the program, you're using your own health insurance to get care. You force us into managed care, which has prior authorizations and narrowed networks. One, we're not going to have access to top doctors in the country because they're probably not in a network of a managed privatized healthcare plan like Medicare Advantage. And I'd have to go through prior authorization to get those approved. And if I don't and I get denied, that further delays my treatment. Then I'm not going to get certified if I can't prove the illness, which is kind of like in what you're going through with this Sedgwick network issue. This is a problem, and this is why we want to try to expose as much of this as possible, because people should not be going through this. Literally, your doctor should say what you need, call Sedgwick, get it authorized in like 1 to 3 days, and then move along. Not this like 3, 4, 5 month procedure where you have to argue, call, fight, yell, scream, call, try to get the email to try to get a response back. This is the last, and this is exactly the point we're making in Medicare Advantage plans, why you should not be forced into them, is because this exact situation, you are infirm, you have health problems, you have a respiratory issue. And if your wife didn't have a good set of lungs to argue for you, you would be having a problem constantly having to fight for yourself when you can't. We shouldn't be in this situation.
Yeah, there's one more piece to that that most people don't really understand. With Mike's disease, idiopathic lung fibrosis. Well, first of all, he's not getting any better in 4 months. Okay.
Yeah.
But also, there's this thing called an exacerbation in his disease. In other words, without any warning, he can land in the hospital yet again, and it could be his last time. Taking 4 months was like taking a big risk to that he'll even make it to this point. No, it's something most people don't really understand why we were feeling so urgent, to make all of this happen. And in the meantime, Mike's progressively getting worse.
Yeah, this and see, and when I spoke to Richie, my friend Richie, about this, and my friend Jimmy about this, we went back and looked at your video interview on the news again and again and again. And the one thing that made me write that first email to NIOSH CDC was the look in his eyes and your face. Because I felt your pain, your struggle, your exasperation, and I'm familiar with that look from my own members and their families. I did not like that here was someone on the other side of the country who came to help us for a month with your team. I think you said about 40-ish people, right? And is suffering. We didn't even know that you guys were having this problem. We thought it was just us. We thought the other people in the national program would be okay. I don't even think it crossed our mind that other people would be having the same problem, and that there is no network of us, because we're all fractured or segmented. We came from different states and different incident management teams and different fire departments and agencies, and there's no one central network that pulls us all together. And just the look of your eyes, that's what made me try to find you. And I just sat that one morning dialing until I guess I got the gentleman that worked with you. And I was grateful for that connection, because I did not like that I felt you were by yourselves in having to fight this. And I wanted you to know that you have an FDNY team here that's wanting to help you, because you shouldn't have to fight this on your own. We wanted to let you know that we're having our own health issues, and we should fight this as a team together. And let all of our voices help boost your voice. They're not listening to us, but your story got traction on the news. So if they're going to listen to you, let's capitalize on that. They're listening to your voice and share that we are all responders, and some of us are just survivors, not first responders, but we're all in this situation the same way. This needs to be exposed, and let's stand together in unity and talk about this out publicly, because you're in a situation today where generally your care is finally being taken care of, right?
Right.
And if it's not, you'll let us know and we'll help you there. But I think your mission for us is to try to elevate this conversation so that no one else has to go through what you went through.
Yeah, I wanted to pave the road so that particularly anybody that was a first responder won't have to go through the trials and tribulations. But I was thinking a lot about the people on the West Coast because they're out of network, et cetera, et cetera. And I was really hoping to pave the road for any of my team members that still might need that.
Mike did not do this for
So-
his own publicity for any reason. We didn't need it. He did it for his team.
No, I hear you on that. And I support that 100%. And I'm not familiar that why it would be, if this is a national healthcare program, a national World Trade Center program, national, Oregon is still in the nation. It shouldn't be out of network. It's
Right.
not like you're in another country.
Right.
You're just on another coast. So why is there no network? And if there is no network, why isn't there an extended network coverage? Why isn't there a reimbursement schedule for out-of-network doctors so that you don't have to go through this? Why isn't there a plan and procedure in place that you can just go to any doctor no matter where you live?
That's,
Well, think about this. Phoenix, St. Joseph's Hospital in the middle of downtown Phoenix, an area of 7 million people. They weren't in network.
one of the bigger transplant centers in the nation. Anyway, but it is, they aren't. And the other thing that isn't out there that I'm aware of, at least I've never seen one, is no information on what is in network. Where do I go? I wasn't given anything that said, oh, go to this person or go to there or go, nothing.
No, nothing.
Just go get treatment.
No, there's,
Well-
on the internet, there's nothing, you can find the manual, but the manual is bare bones. There's not enough information in that manual.
Do
There's
you
nothing.
know that Sedgwick used to have a Find a Doctor tool on its website? And one of my retirees called Sedgwick to say, your doctor tool isn't working. So the only thing they did was take it off. They took it off their website. That's because no matter where you put your zip code in, there was no doctors. Now, Sedgwick is owned by the Carlyle Group. The Carlyle Group is a private equity firm. I don't think there is a network. I think this is a ghost network. And this is why when I use that word, that what you're going through is criminal, is because I can't fathom why in a state like Florida or in a state like Georgia or in a state like Oregon, we can't find doctors.
Yeah.
And that they won't even publicize their damn network.
Yeah.
Well, one of the other issues that we ran up against at Legacy Hospital was that every time I'd say, hey, we have Sedgwick, they would go, oh, that's that workman's comp group that
Yeah.
they deny everything. We really would hope that you would use something else. We don't get any, every time you say that word Sedgwick to anybody who's in healthcare, they know they won't pay. Even though MCA Sedgwick is somewhat different from the workman's comp, I guess, they're run exactly alike, deny. And so when we went to one of the other hospitals and Mike got a second opinion on his disease, we checked in, we gave them our card for Sedgwick, and they go, okay. you know, they have everything they need with that card, and yet when it came down to the billing, we never saw a bill until finally it was practically in collection, and they go, well, we sent all your stuff to Sedgwick and we never heard back. And when I quizzed them, I said, who did you send it to at Sedgwick? What address did you use? Well, their computer overrode the address that they were given on the card. They just deferred back to another Sedgwick that was workman's comp. And so it was all going into basically into a black hole, and they didn't know it. And I had to clue them in and try to get it paid and like that.
So now
It's one thing after another.
your team you expressed was about 40 people. Are they all is still in the same Oregon area, or are they've all
No,
moved?
they retired, and a lot of them moved out into places where they wanted to move in retirement. So they're not all in Oregon.
Like
Yeah.
one of his team members lives around the corner from where we're staying in Arizona, and
Yeah,
so yeah, they're spread out a little bit, although quite a number of them are still in Oregon.
Oregon and Washington. That was Region 6, so most of them were in Oregon and Washington, but they scattered around.
So in the course of all these years now since World Trade Center that they all started, many of them started to get sick. You had mentioned you had 2 people that had committed suicide, and you have about a quarter more or a third more that are sick at various stages of illness.
I would say that right now we're about 25% of the team has issues associated with the World Trade Center, or they're deceased. One of the two.
Okay. And you formed some sort of a network to educate them.
Oh, yes.
He has an email list.
Oh,
Good.
yes.
Mike was, maybe this is too strong of a word, but Mike was pretty beloved by his team, honestly. And so they care, they're being apprised of where we're at in this journey, and they're wishing us all the best, honestly.
Good. I applaud that, because that's one of the things that we found was getting us through when we were struggling in different bouts through this fight over the last 20 years, is we had each other. And I think inherently EMS people, fire department people, we have our little social groups. We have a couple different retiree groups. We have some social media pages, but as we're getting older, there are a lot of people that are still not on social media, and we rely either on social media or on our email list to stay in touch with each other. And then we still pick up the phone. So that is where, we're able to stay in touch with each other and help them, guide them. When we were trying to reach out about a couple months ago, when we think it was like February, when we really started to push back more on the problems we were having with this World Trade Center program. I mean, look, they haven't even called me back in for my annual, and I think this is now 2 years that this has been an issue. And I don't understand this, because they used to call us religiously to set up the appointments. They're not setting up the appointments. So we stayed in touch, and we always did. And EMS, FDNY EMS, we have like annual reunions. We do online chats for people that can't make it in. And then during COVID, we were very active online to keep each other connected in some way. So keep that. And if you need help with that, reach out to Richie and I. We'd be glad to help you with that. But we also want to make sure that they have the information. And then we're pushing to get a congressional hearing on this, because you're absolutely right. No one should have to fight for healthcare. Even our argument in New York City, where we're fighting the mayor for our healthcare, we argue that healthcare is a human right, not a political fight, and that we earned and were promised this, that they would take care of us for everything that we had done, and they're not living up to their end of the bargain, and it needs to be called out. So if there's something that we could help you both with, let us know.
I don't know what to add.
My heart goes out to everybody that was there.
And my heart goes out to everybody right now who hasn't had their bills paid, who can't get health care. I understand that mental health care is one of the hardest things to get right now due
Yep.
to such,
Yes.
we've heard from some other people, and it just doesn't need to be this hard. It really shouldn't be this hard. And like you said earlier, some of these people are saying to me, I don't have anybody to work like you did for Mike. And that breaks my heart too.
Yeah, that's why I wanted to contact you, because I knew he could use the help, but I also knew you could too. Is you'd have someone to vent to and someone to say, hey, help me with this, because I know you're going to be tired and exasperated, and your main focus is making sure he has what he needs. I want to make sure that there's someone looking out for you too.
I'm very fortunate. I have such great friends that
Good.
I have a lot of support too.
Wonderful. So stay in touch with us. And if there's anything that we can do to help you, let us know. I want to make sure that these messages of people like yourself, responders that are suffering from an inefficient, insufficient World Trade Center program that should be taking care of you so that you can focus on your health and recovery. That those elected officials who promised that this would be in place are focusing on fixing this program, because 20-something years later, this is even in worse condition than when it started. At least there was hope from when we put the program together and it was building. We understood that there would be some growing pains, but after 20 years, this should literally be running like a fine, smooth machine, and it is not. And at this point, where we knew at 20 years after, this is what would have been the most critical time when cancers and all these diseases were going to start popping up, according to the epidemiologists. We're right in the middle of that. And the health system that's supposed to be there, that we should be able to rely on, is not there for us. So,
And I would add one more thing. I am not an attorney. I probably shouldn't say this, but when somebody, a big, huge corporation, takes a contract from the government and they are supposed to fulfill certain parts of that contract, right? Isn't it fraud when they're taking that money and then not completing the contract as agreed? Doesn't that qualify as fraud? I'm not an attorney. I don't know. I'm just asking.
I agree with you. Yes, because if someone hired you to do something, and well, at the start of this conversation, Mike was saying that there were some seedy people that had stolen supplies from the vendor. Well, if you were hired to do something and provide a service and you didn't, or you transferred those services to yourself, you would be arrested and go to jail. Theft of services, even service time, whatever. How is it possible that a major company like Sedgwick MCA, owned by Carlyle, taking taxpayer dollars, your taxpayer dollars, to fund a program that's supposed to serve you, and that they're not fulfilling their contract, they're in breach of contract? Where is the government in the 2 years that this contract has been in effect to say, we're not giving you another dime, and then just start telling everyone, go see your doctor and send us the bills and we'll just start taking care of them, because that's really what they should be doing. Honestly, at this point, I think they should be putting us all through like a fee-for-service type Medicare type program, which we had originally talked about was one of the options like 20 years ago, is just put us through put our bills through Medicare and you pay them. MCA and NIOSH CDC would pay them, put us through a Medicare type program. Because at this point, every doctor in America, 99% of doctors in America accept Medicare. You don't have to worry about networks and prior authorizations. Cover it this way and coordinate it with CMS and NIOSH CDC. That should really be the way this should be fixed.
Yeah.
I'm gonna end this here. It was great chatting with you both and getting to meet you. And if there's anything we can do, please let us know. And then we're just gonna stay in touch, okay?
Sounds good.
Thank you so much for putting this on.
You're welcome.